Hello everyone, this is Dr. Kanchan, Department of Psychology, GC Faridabad. In today's video, we are going to discuss about the Parkinson disease. So what is Parkinson? This is a disease of the nervous system in which neurons that produce one of the most important neurotransmitters, which is known as dopamine, are gradually destroyed. Most often, Parkinson disease affects people aged 55 to 65 years. However, there are cases when the disease was diagnosed in young people also aged 30 to 40 years. In some cases, it has been found that this disease affects adolescents under the age of 20 years. So, what are the symptoms? The most common symptoms for Parkinson include stiffness of the legs. A person cannot walk fast since it is difficult for him to control the work of his or her muscles. Problem with maintaining balance, circulatory disorders, chronic constipation, violation of the REM, sleep or rapid eye movement sleep phase. At the time of falling asleep, a person behaves not just restlessly but actively. However, after awakening, a person cannot remember this. Then handwriting issues. This may become more cramped and smaller. Sense of smell. In the cases of Parkinson disease, the person lost the sense of smell, and this is the early sign. Now we will discuss the causes of disease. So basically, primarily genetic causes are the main cause. If you have had cases of Parkinsonism in your family, especially among close relatives, then your chances of getting sick are slightly higher. The environmental situation also plays a role. It is known that some herbicides, pesticides, and salts of heavy metals can increase the symptoms of Parkinson's disease or provoke its development. In 80% of cases, Parkinson's disease develops without any prerequisites, but in the remaining 20%, Parkinsonism is a complication of the other diseases such as brain tumor, stroke, traumatic brain injuries, and some others. Sometimes poisoning with certain toxic substances like carbon monoxide, ethanol, as well as the use of narcotics substance and certain medications, in particular antipsychotics, lead to Parkinsonism. Main 5 stages of Parkinson disease. Stage 0, in which the symptoms will be lack of motor impairment. Stage 1, motor disorders on one side of the body. Stage 2, motor disorders in which the patient walks without restrictions, maintains balance. Stage 3, moderate postural instability appears, but the patient does not need outside help. Stage 4, significant violations in motor activity. The patient cannot make complex movements but does not need support in order to stand and walk. Stage 5, the patient cannot move without assistance or support. So it is important to know what is the treatment. For the treatment, carbidopa or levodopa are the main therapy. Then dopamine receptor increases or agonist are the main therapy. But when it does not do any help, we go for the surgical treatment. If drugs therapy does not sufficiently control the severity of symptoms, or if intolerable adverse events develop, then we go for the surgical treatment. Then the last is the most effective treatment is exercise and measures to adapt the environment. So these are the basic treatment process for decreasing the symptoms of Parkinson disease. Thank you so much everyone for watching this video. Hope it will be a great help to you. Thanks once again.